During intubation, the patient's arms are controlled by the lateral pads. The anesthesia doctor will want the patient in the so-called sniffing position, such that their head and neck are displaced anterior to the thorax. This can be achieved in many patients by adjusting the AP adjust either down or up. Once anesthesia learns how to do this, they can acquire the sniffing position in the initial positioning of the thoracic assist may help achieve the appropriate position. This is an example of a common error in positioning the patient for intubation. The patient's hips are too low, such that the occiput is impinging on the neck pads. This creates an angle of the neck, which makes it very difficult for the anesthesia doctor to intubate. To correct this, the neck pads are adjusted inferiorly. The patient can be asked to scoot their hips more in the crack. And this is much better. Still, sometimes the thorax can sag a bit here, and in this case, we can use the optional thoracic pad to correct this. This would have been positioned prior to intubation. And for demonstration purposes, you can see how the alignment is corrected. Occasionally, again, you may have an assistant during intubation perform a simple chest rise maneuver to allow intubation and then to proceed to the sitting up portion of the case. Another thing that the anesthesia doctors often like to do is to rotate the head into this position. The sliding headpiece allows the anesthesia doctor to push and lift at the same time, achieving the sniffing position. When the patient is in the intubation position, we check the alignment of the thorax relative to the head. The thoracic pad is supporting the patient's thorax. Another maneuver that the anesthesia team will want to be able to do is to rotate the head and displace it anteriorly to achieve the sniffing position. Allowing the head assembly to free float allows one to compress here during intubation, which will assist in the intubation process. Additionally, if a manual thoracic support is needed, that can be done as well.